Hi there, in this video, I'm going to show you some simple home remedies that you can use to blood and semen. These remedies are all natural and easy to follow, so stick around and I'll show them to you right now. Semen is made up of sperm as well as fluids secreted by the prostate and other organs. The fluids, also known as ejaculate, combine with the sperm as they travel through a network of channels to the urethra for ejaculation. A variety of things can cause blood vessels to rupture along this route or the urinary route to the urethra. Damaged vessels cause blood to seep into the sperm, urine, or both. Your doctor will inquire if you've recently undergone prostate surgery or a prostate biopsy, as these treatments can result in blood in your sperm for several weeks later. Most of the time, there is no explanation for blood in sperm. Infection is a suspected cause in some cases, particularly among men under the age of 40. Other signs and symptoms of infection, such as uncomfortable urination, are common. Severe or recurring blood in sperm in men aged 40 and older may be a warning indication for illnesses such as cancer in rare circumstances. As a result, a more thorough examination may be required. Nonetheless, the risk is negligible. Prostate cancer developed in between 4 and 6% of men in follow-up studies of males, generally over 40, who had blood in their sperm. Blood in your sperm is a common sign of a problem, but it is generally just transient and rarely harmful. If it happens more than once or you have other unexplained symptoms, you should see a doctor to see if you have any health issues that need to be addressed. How serious is blood in sperm? If you notice your sperm is bright crimson, reddish brown, or pink after ejaculation, you're one of many people who have semen hematospermia, blood in your sperm. As a one-time occurrence, this is normally nothing to be concerned about, especially if you're young and in good health. Yet, even though the cause is mild and transient in most circumstances, never ignore it because blood in sperm might signify a dangerous ailment such as prostate cancer or testicular cancer. The chances of this increasing as you get older remain tiny but do increase. Prostate cancer statistics, for example, show that the most prevalent reason for blood in sperm. More than 90% of instances are triggered by sexual activity. According to men's health specialist Dr. Jeff Foster, a physician at H3 Health, this is related to the rupturing of blood vessels, which can occur during any sort of intercourse, including masturbation and penetrative sex. This is fairly common, Dr. Foster recommends. Yet, while being a very unusual cause, this could be a symptom of testicular cancer. As a result, it's critical to be examined out. Your frequently asked questions: why is there blood in my sperm? Just about 10% of cases are triggered by anything else going on in your body, and there are numerous causes. To investigate this, Dr. Foster addresses the following frequently asked questions. Is it possible for a UTI to create blood in the sperm? Potentially, Dr. Foster says. In general, healthy and fit men do not have urinary tract infections, UTIs. Thus getting one can suggest that something more serious is wrong with your body. Hence, if you find blood in your sperm that you suspect or know is due to a UTI, don't assume everything is fine. It is critical that you see a doctor, especially if you are above the age of 30. Some infections can also cause blood in sperm. For instance, a sexually transmitted infection, STI, like chlamydia or gonorrhea, or epididymitis, an infection of the tube at the rear of your testicles. Is it possible for prostatitis to create blood in sperm? This is also accurate. According to Dr. Foster, prostatitis is a condition in which your prostate, a gland located between your bladder and penis that generates a portion of your sperm, becomes infected or inflamed. Prostatitis, like a UTI, can cause pain in the testicles or penis, painful urination, increased urine frequency, and blood in the sperm. Does BPH produce blood in the sperm? The prostate gland is also affected by benign prostatic hyperplasia, BPH, also known as prostate gland enlargement. Dr. Foster, on the other hand, believes that this should not be the cause of blood in your sperm. While the prostate has grown in size, benign means it is not angry or irritated, as in prostatitis. The main symptoms are urination difficulties and the inconvenience of having to pee more frequently. An enlarged prostate is a typical component of aging in many men. It affects the following ages. 2. 8% of males in their 30s. 25% of males in their 50s. 33% are in their 60s. 50% of men over the age of 80. Is it possible for a hernia to create blood and sperm? No, hernias never directly disrupt the tubes that create sperm, Dr. Foster says, but they can press against this region. A hernia is a bulge in another part of your body caused by an organ or segment of tissue pushing through a weak spot in surrounding tissue. While this does not cause blood to enter your sperm, it can occasionally put pressure on your scrotum, resulting in scrotal and testicular pain. Is it possible for kidney stones to generate blood in sperm? Absolutely not, says Dr. Foster. Kidney stones pass via your kidneys, ureters, bladder, and urethra, but not through your testicles. The discomfort of kidney stones, like that of hernias, can be felt nearby in the body. This is why some people with kidney stones suffer discomfort in their testicles.